We're running a bit late, so I think I'll start. We have three topics on the slit lamp. One is the basics of slit lamp, the examination, and the drawings, anti-segment drawings. So I want to thank the KSOS for giving me this opportunity. And I'll start with the first topic, which is the basics of slit lamp examination. So my talk will go through a bit of the history of slit lamp examination, the types, the history of slit lamp, the types of slit lamp, and the parts of the slit lamp. The slit lamp is basically an illuminated microscope where we can examine the anterior segment, even the posterior segment, stereoscopically. The history of the slit lamp, though Gullstrand is credited with the invention of the slit lamp, a lot of people who came before him who played their own role. So Perkinjean, early as 1920s, he used an illuminated microscope to examine the iris. Then Louis de Wecker actually created an instrument, a portable instrument, but it's a uniocular instrument to examine the anterior segment of the eye. Well, it was in 1891 that Albert and Greenough created the first binocular microscope with the stereoscopic view. And Zapsky in 1897 created the binocular microscope, which looks similar to the slit lamp we use now. Well, in 1911, Albert Gullstrand introduced the illuminating system, and for the first time, they had a slit diaphragm. So he is credited with the invention of the slit lamp. And just a point of note that Gullstrand is still the only ophthalmologist to win a Nobel Prize. What are the types of slit lamp? There are basically two types, depending on the illumination, where the illumination comes from. One is the Hack Street model, where the illumination comes from the top. And second is the Zeiss model, where the illumination comes from the side. This Zeiss model is a more compact type of slit lamp, but the Hack Street model has advantage that the illumination arm can be tilted. This is the knob which we use to tilt it, the lever which we use to tilt it. The advantage of tilting the illumination arm is because when we do a mirror examination, like a gonioscopy or a three-mirror examination, we can reduce the glare. What are the parts of the slit lamp? Basically divided into three parts. One is the illumination system, one is the observation system, and the mechanical system which holds both of these together. So this is the illumination system, which has a housing for the bulb. It has a measurement system. It has different filters and a handle to rotate the measuring system. Illumination, what we call is a Kohler type of illumination, where the light source goes through a condensing lens, goes through a slit and various filters, and goes through a projecting lens into the mirror. From the mirror, it is projected into the eye. The peculiarity of this system is the light source is focused into the projection lens, and the slit is focused onto the eye. So this is the light source, which can be a halogen lamp or a LED lamp these days, a condenser lens. Then it has the slit system, then passes through various filters which you can choose, goes through a projection lens, and then into the mirror, into the patient's eye. Well, you can use the scale to measure any lesions on the cornea, where you can measure it vertically, and this is the knob which you use to turn the scale. And you can measure it, you can change the slit to measure it horizontally or obliquely. Well, there are a lot of filters here, and you can choose what filters which are used. We all know about the cobalt blue filter, which we use for the fluorescein dye. There's the red-free filter which you use to see the blood vessels and hemorrhage and scleritis. Natural neutral density filter, which is marked with hashed lines, to decrease the brightness to make it more comfortable for the patient. Then you have a gray filter marked by a thick line, which again reduces the illumination for the patient. Yellow filter is not present in all slit lamps, but it's usually in the observation system, supposed to enhance the fluorescein staining. And then you have a diffuser. This is a diffuser, which is usually kept in front of the mirror, so that you get a diffuse illumination to examine the eye. The width of the slit can be adjusted by this knob in the Hack Street model. and you can get it to different width sizes you want for different types of illumination. Well, the observation system. The observation system is basically a binocular microscope. It has an eyepiece, it has a prism housing, and it has a magnification and objective lens. But look at the magnification. Basically, there are two types of magnification, the Greenough type and the Galilean type. The Greenough type is just a flip magnification. You get only two magnifications, 1x or 1.6x. It just changes the objective lens. While the Galilean microscope uses a convex and a concave lens, a combination of the two, and generally you get around 5-step magnification. Another way you can change the magnification of slit lamp is by changing the eyepiece. Certain slit lamp manufacturers give you two sets of eyepieces, where you can change it either to 10x or 12x eyepiece and you can get more magnification. Well, there is, in the eyepieces, you can adjust the eyepieces according to your refractive error, either plus or minus, or if you're using glasses, you can leave it at 0. And you can adjust the IPD by just moving the eyepieces around. This is the optics of the observation system. This is the object or the eye. It passes through an objective lens. Then it passes through the magnification system. In this case, the Galilean telescope is shown. Then it passes through a prism system called the Poro-Ab prism system. What this does is, one, reduces the size of the observation system. Second, it turns the image upright. Otherwise, we'll be seeing an inverted image. And then you have the eyepiece. Then we go to the third part of the slit lamp. It's called the mechanical system. This consists of different parts. One is the forehead band, where you want the patient to oppose his forehead to. You have a canthal alignment, where the lateral canthals are aligned, so you can move the slit lamp and you can examine the eye. Then you have a chin rest. You have a hand grip for the patients. You have a lock if you want to lock the slit lamp. You have a lock if you want to lock the observation system and the illumination system together. You have a joystick to move the slit lamp front or back or up or down. You have a pass switch. You have the rheostat, which can adjust the illumination. You have a chin adjustment knob to adjust the height of the chin rest. And you have a fixation target. And you should understand both the observation and illumination system are coupled. That means both are focused to one point. This is important to know. For some illumination, we might have to decouple. And both rotate around a common axis, both the observation system and the illumination system. They can be rotated together or separately. And sometimes in some illumination, we have to decouple the system. That means we have to take the light away from the focus. And this is the knob to decouple the system. You just loosen this knob and twist this illumination system and decouple. With the slit lamp, we use a lot of accessories. I won't go into the details, just mention them. You can have a camera system. You can have a side tube. The observer can watch, use different types of mirrors and lenses. And you use the illumination tonometry. So to conclude, the slit lamp is a simple but important instrument for any ophthalmologist. It is essential that every student has good knowledge of the working and the various parts of the slit lamp. Thank you.